One. So, Dr. Russo, Diane O'Donnell, who's an APNP in Wauwatosa, Wisconsin, asks, let me do the other question first. Adam Mikiewicz, psychiatric APRN in Connecticut, asks that CBD has been touted, to treat several psychiatric illnesses with minimal side effects. It seems too good to be true. Uh, are there actually robust, like randomized controlled trials to support the use of CBD for psychiatric conditions?
Yes, there are. I would point your listeners first to a superb review article. I was pleased to be a peer reviewer on this article. This is called Medical Cannabis and Mental Health, a Guided Systematic Review by Zach Walsh. This was in Clinical Psychology Review 2017, so very current, pretty much comprehensive view on this issue.
Great. I will link to it.
Sure. So that's a terrific article. In terms of formal randomized controlled trials in the psychiatric realm, unfortunately, there haven't been a lot. However, the most obvious ones in terms of therapeutic effect would be 2 phase 2 clinical trials of cannabidiol in psychosis, schizophrenia. So there was a study done by Levica et al. Some years ago in which they compared CBD in a high dose, 800 milligrams a day, to amylsulpride, which is a conventional drug used more frequently in Europe for the condition. What they saw was equal efficacy of the 2 drugs, but with a much improved side effect profile for the cannabidiol, because it worked for negative symptoms as well as positive symptoms of schizophrenia. So some time elapsed. Subsequently, there's been another clinical trial of cannabidiol that GW Pharmaceuticals has completed but not published. It is on their website, gwpharm.com. And similar benefits of what we presume is a high dose of cannabidiol in treating psychosis. So there is that. In the area of anxiety.
And also the McGuire. So there's a paper by McGuire in American Journal of Psychiatry that was just published. 1,000 milligrams of CBD added to antipsychotic, randomized, placebo-controlled in schizophrenia, and that was also a positive study. So there is some data in schizophrenia.
Right. Well, see, you got me there. I haven't seen that one yet.
Okay.
Hopefully it was very recent.
Yeah, it was last month, yeah.
Okay. Like anyone else, I get behind in my reading.
Yeah, sure.
But
and anxiety, you were saying anxiety.
Yeah, anxiety. There's been a lot of work, and this addresses one of the questions I saw on the list that was submitted. There have been various experiments, especially done in Brazil, looking at cannabidiol in treatment of anxiety, experimentally in public performance situations. Presumably they had student volunteers, some work with patients, small numbers, and they've been able to show benefit on anxiety scales as well as fMRI studies. Then there's a whole area of addiction and dependency. There have been a number of studies that both basic science and clinical studies that would indicate benefit of cannabidiol on addiction and dependency issues. One of the effects of high-dose cannabidiol is to suppress activity in the insula. And we know from prior studies from NOCV that when there is damage or depression of the insula, that this reduces craving associated with drugs of abuse. In depression, there have been some signals, mainly from survey studies. Many patients, say, for example, with chronic pain, have concomitant depression and report anecdotally improvement in that when using cannabis medicinally, but there haven't been any formal dedicated studies in garden variety endogenous depression, for example. But theoretically, there certainly may be benefit there. In PTSD, we have a very important study by Hill et al. Let's see if I can get this citation
Yeah.
exactly for your listeners.
Yeah. Kevin
This
Hill
was,
at McLean and in Belmont, Massachusetts. Yeah.
yeah, this was Psychoneuroendocrinology 2013. Reductions in circulating endocannabinoid levels in individuals with post-traumatic stress disorder following exposure to the World Trade Center attacks. So basically, very quickly, what happened in this study was they looked at people who had been involved in 9/11, two groups: those who had PTSD diagnosed, those who were exposed to the events but did not display PTSD. And they did CSF examinations and showed reductions in circulating endocannabinoids, anandamide and 2-arachidonoglycerol, in the patients with PTSD. So this is very important because it's showing that this is part of the pathophysiology of this disorder. There have been some small studies, especially from Israel, looking at this with benefit, tremendous amount of anecdotal material.
Yeah.
But if you think about it, there's a reason for this. We have the study from Hill. We also have the fact that there are a couple of cardinal symptoms of PTSD are intrusive dreaming, these nightmares that people have a complaint about. What does THC do? One of its activities is impairment of short-term memory. It also suppresses REM sleep. Not in a dangerous way, but sufficiently so that people who use it report that they're not having the nightmares anymore. And that when they use cannabis, they're able to distance themselves from their panic that might be related to loud noises or being out in public, whatever sets them off to their memories, intrusive thoughts about their original trauma.
Yeah.
So there's not just a biochemical basis for this, there is a psychodynamic basis, foundation for use of cannabis in this condition. And then, especially with a little bit of CBD, we get the antipsychotic effect, the anti-anxiety effect. So this is a situation where some THC is necessary and helpful. But a little CBD may be of benefit also. And I wonder how many of the patients who've used cannabis for treatment of PTSD have really had the opportunity to have any significant amount of CBD with their THC, which is almost invariably present.
Right. So in your opinion, for PTSD, should they? Do you predict that CBD alone would be efficacious, or that it would be a combination of CBD and THC that might be
I would
optimal?
favor the latter. And again, this is a question that comes up with any given condition. And I have ideas about what I think works best. This is an instance where some small amount of THC really seems to be necessary. I do think that would be helpful with supplementation with CBD. And hopefully this would be available in one preparation.
So that's a good segue into a question by Dr. Chris Kotner from Kirkland, Washington, in your state. Which is that he asks if it is true that CBD's therapeutic effect for anxiety is enhanced if taken with a small amount of THC, like a 14:1 ratio. So it seems like you're saying that there may be some truth in this, that a small amount of THC is helpful.
Right. That may be, sure. The ratio is less important than the total doses taken. So say we had predominantly CBD preparation, but someone took too much of it, so they had 15 or 20 milligrams of THC at once, chances are they're still going to have THC-related side effects. It's not a situation where you can totally or likely totally prevent adverse events associated with THC just because there's some CBD there. It will help, but if the total dose is too high, a person could still get into trouble. So in any kind of situation like this, our best practical advice is to start very slowly and titrate up slowly People will develop a tolerance to the psychoactive side effects of THC over the course of about 2 weeks. So they may tolerate a dose at 14 days that they could not handle
Okay.
at the beginning. So this is extremely important.
Okay.
Now, the benefits medically, whether it be on pain, spasm, or other symptoms, are going to persist. But the tolerance to the side effects is a feature of good practice in applying cannabis-based medicines.
Just like some of the other medicines that we use.
Sure,
It's
we
the
don't
same.
start with
Yeah.
100
Yeah.
milligrams of amitriptyline. You
Yeah.
never do that.
Right.
Um,
So,
so, yeah, I mean, some of this is common sense, but I think it's particularly important here. If a patient overdoses straight out of the chute, you've likely lost them. It can be very scary. It can cause them to wind up in the ER. And this is to be avoided at all costs.
what would happen if they took a lot of CBD, like 1,000 milligrams or something on day one? What is that? What are
Of
the
CBD without THC, likely no ramifications to that.
so CBD is very safe in overdose,
It is.
relatively, yeah.
Yeah, I mean, it's an extremely non-toxic drug. The only problems with CBD have come in extremely high doses associated with polypharmacy. Specifically, let's give the example of these children with Dravet syndrome. When combined with clobazam, benzodiazepine used to treat seizures,
Yeah.
there is a buildup of N-dysmethylclobazam metabolite that's sedating. And the solution to that is to lower the clobazam dose. It isn't necessarily the case to get rid of the CBD because it is a drug-drug interaction based on P450 metabolism, etc. But in general, it mixes well with other medicines. There are very, very few of these specific drug-drug interactions, nothing that would be a specific contraindication.
Yeah.
And again, because of my work at GW Pharmaceuticals, we had experience of using cannabis-based medicines with every conceivable drug. You know, people with cancer on chemotherapy and polypharmacy,
Yeah.
12, 15 drugs. And we know that surprisingly, there are few problems with these combinations. Now, additive sedation is always possible,
Okay.
particularly with the THC preparation, but it was very surprising and illuminating how infrequently this turned out to be a difficulty.
So this answers Dr. Chris Kotner's question about how concerned we should be about the P450 enzyme effects. And you're saying most of the time there is no problem unless it was high doses. And
That's correct.
Right.
Sure.
Okay. And then Diane O'Donnell, APNP from Wauwatosa, Wisconsin, asks that if CBD is taken for anxiety and the person starts CBD for the first time, is the person likely to get an immediate relief and have a calming effect, similar to a benzodiazepine, or does CBD require time to build up and have an effect similar to an antidepressant?
Well, it sure could have an immediate effect. It depends on the dose and mode of administration.
Yeah.
The bioavailability of the formulation, whether there actually is THC in it. So these are all variables that we'd have to know to give an informed kind of response. But as shown by the studies from Brazil, acute higher dose CBD has an immediate anti-anxiety effect.
Right.
So yeah, there are acute effects. CBD, however, is a medicine that is likely to have its best effects when used on a more regular basis. The reason being that it has an analogous mechanism to the SSRIs with serotonin in that it will reduce the breakdown. It has an inhibition of the fatty acid amide hydrolase. That's the enzyme that breaks down anandamide. So we believe that over time, CBD administration will upregulate the endocannabinoid system, improving tone in the system and offering better buffer against anxiety and other disorders. Now, that's more theoretical, but I do believe that it is apt to work better over time, yes.
Right. So Dr. Chris Cotter has a question. He said that some people have suggested that cannabis has biphasic properties. So, or cannabinoids have biphasic properties. So, meaning opposite effects at low and high doses. So
Right.
he prescribes CBD starting low at just 8 milligrams in the evening or bedtime, and then he increases his patients to like 3 times daily as needed for anxiety. Does that seem reasonable? Like start 8 milligrams, increasing to 8 milligrams TID, or is he dosing too low?
Well, it may be. The proof will be in the proverbial pudding. Obviously, the best dose is that which satisfies the patient's needs. I would think that they probably need more than that, but it
Yeah.
depends on all these other factors. Now, in relation to this biphasic effect, that's a well-known phenomenon associated with the cannabinoids. But let's keep in mind, this is with pure CBD in animals. A very interesting study came out of Israel by Ruth Galili, Gallili. This was in Pharmacology and Pharmacy in 2015. And she showed that was previously a bell-shaped curve response with cannabidiol was eliminated when the cannabidiol was part of a cannabis-based extract. In other words, that is to say that when it was a whole plant extract with CBD at an equivalent dose, that you had a more normal straight line sort of effect on pain or other symptoms.
Yeah.
In other words, even a high dose wouldn't cause pain and still had an analgesic effect. So this comes into the whole discussion of pure versus extract.
Yeah.
Now, I think most of your audience was classically trained in pharmacology, mainly with new chemical entities, etc. But I've got to tell you honestly, I'm a plant guy. I believe in a synergy of ingredients. And this article highlights that effect, that CBD is a better drug therapeutically when it's got its other components from the cannabis plant with it.
Yeah, I see. Because I thought that the using the pure form might be better, and so
Well,
I have been prescribing a brand that is pharmaceutical quality, pure CBD, from Procana.com. So Dr. SP, that's a good segue into asking Dr. SP, who's a psychiatrist in the United States. He asks, so what is a good reputable brand then, something that doesn't require a prescription? Many patients ask about it. They say, well, what CBD should they get? Or if you don't recommend something, they'll just get it on their own. He wants to be able to guide them. Do you feel comfortable either recommending a particular brand or telling us how to think about the brand and choose a brand?
right. No, I can't recommend a specific brand because unless I have a certified analysis in front of me, I don't know what they're getting.
Yeah.
This is the problem that every clinician and patient is going to face in the current environment.
Yeah.
To me, it would be far better if we had a situation where patients could go and get not just a cannabinoid profile, but also a terpenoid profile and assays to show that the material is free of pesticides, heavy metals,
Yeah.
microbials, but we're not there yet. In a regulated market, all this information would be available, and I'd be comfortable saying that brand X is good and brand Y is not. But
Yeah.
as it is, I can't go there.
Right. Okay. So Dr. Glenn Lipman, MD in Tucson, Arizona, he asks, does CBD use lead to a positive urine drug screen that can cause legal issues or confuse treatment for people in a substance use treatment program?
Not unless there's THC in it, which would produce in a sufficient amount to produce THC metabolites.
Right.
So the answer is maybe, but maybe not. And again, this is an important issue for patients who may have a legitimate need for cannabis-based medicine, whether they're going to get in trouble with their employer.
Right.
So we've got, again, a discrepancy between a situation where people are obviously sick and obviously benefit from cannabis-based treatment, but don't have benefit with disability laws or legal protection for their use. Because
Yeah.
as it is now, any employer that wants to do a drug test um, apparently has the legal right to fire such a person.
Right.
To me,
But
it's not fair, but
yeah, correct.
I
But
don't
the
think the rule.
UDS, the urine drug screen is checking for THC, not for CBD. CBD per se will not show up in standard urine drug screens.
I
Is
would
that
if they
correct?
look for it, but it's normally not part of the screening.
Yeah,
It's usually
THC.
THC, THC-COOH, and various metabolites, which interestingly are inactive, but they persist.
Yeah,
They can persist up to 30 days depending on the intake the patient has had.
right. Okay. Now, Dr. Anne De Jong, PhD, who's a psychiatric and mental health nurse practitioner in Montclair, New Jersey, she asks, "What is the efficacy of CBD for Parkinson's disease?" Because there is some data on that, right?
Yeah, just a little bit. Small trial, some benefit. We really need in this situation. There's a lot of debate about this. Also, this is not a new thing. It may be interesting. Maybe people will recognize Sir William Gowers, one of the founders of modern neurology, recommended cannabis for Parkinson's treatment. This is a different situation
Ah,
than most. We've
how,
talked about how cannabis in certain conditions can have a very acute effect. That's not usually the case in Parkinson's. Often the patient needs a prolonged treatment interval to show any benefit in what is a complex disorder. Also, we don't know exactly the contribution of the different components. THC, CBD, even THCA, raw cannabinoid, undecarboxylated. There's some evidence from the Czech Republic, a big survey that was done about 15 years ago, showed benefit in prolonged treatment eating raw cannabis preparations. So that one hasn't been researched and really needs to have formal trials. So the answer in Parkinson's is it may help. It depends on the preparation, and we don't have any big RCTs from which to draw
okay.
at present, but hopefully that will change.
Okay. And Dr. Duncan Scott, MD from Kingston, Ontario in Canada, asks about what are your feelings about the use of CBD in our pets? Has it been, are you aware, like, has it been used in animals also?
Well, in fact, cannabis was a mainstream medicine in veterinary practice for the same interval that it was a mainstream medicine in human practice in this
Really?
country.
Wow.
Uh, yeah, between about 1840 and 1940, about the time it was made illegal. Additionally, yeah, we have a lot of attestations from pet owners about benefits on their pets. And it is a situation where we can't say, well, it's all in Rover's head. He's not taking
Yeah.
it to get high. He's taking
Yeah.
it because you're giving it to them.
Yes.
Um,
Right.
so, yeah,
So there is some
I'm
role. Yeah. Perhaps there is
yeah,
some
I'm
role.
the son and brother of veterinarians, and I have delved into this literature quite deeply, and it's very compelling. I just add that cannabis-based treatments are life-saving in horses and other equine related species, horses and mules that can't vomit. So when they get colic, they can die from that. But cannabis was used previously in these preparations and was life-saving.
Yeah.
So again, that's not psychosomatic.
Right. So I have one question of my own, which is to me the like a very pressing question about CBD, which is the dose of CBD is very confusing to me because when I look at the social anxiety, the public speaking studies, they give like 200 or 300 milligrams single dose like an hour before the person confronts the anxiety. So they're talking about 200 milligrams 300 milligrams, something like that.
Right.
And I looked on clinicaltrials.gov, and the various studies that are going on are also using something in that range. The schizophrenia study used 1,000 milligrams. But
Right.
when you go online and you try to look at what is the CBD being sold, the products, they are like 8 milligrams, 20 milligrams. So the
Right.
person would have to take like 10 capsules every day or 10 capsules 3 times a day.
How about that?
Yeah,
No, that's exactly right. So there's this big discrepancy. Now, I'm not going to say that someone who takes one of those preparations might not benefit from it. That remains to be seen.
yeah,
I can't vouch for its efficacy, its composition, or its safety.
right.
None of those.
Yeah,
But in general, I think that the expected dose of CBD would be a lot better, lower, if there were a little THC for almost any indication.
okay.
Um, there is a biphasic effect with THC with respect to anxiety. A little bit is helpful. Too much is bad. This was known 4,000 years ago to the Sumerians, who, in relation to cannabis, one of their cuneiform tablets said for or against panic. Um,
Wow.
so this biphasic effect
So,
has been known for 4,000 years.
So for or against panic, going back to the Sumerians, they knew that it could like either improve panic or worsen panic. That's what you mean?
That's what I mean exactly.
Wow, so cool! What so cool? So let's wind up our discussion of CBD with two related questions from Adam Mikiewicz from Connecticut. And Adam asks, how far away time-wise is CBD from being in the marketplace and available to be prescribed? And related to that, the question is like, is it true that the reason there is slow progress from bringing CBD to the market is that there's not a profit incentive for pharmaceutical companies to fund research in this area?
Okay, well, again, we expect Epidiolex, primarily CBD, to be approved by the FDA later this year, 2018. However, two caveats there. One, this is apt to be quite expensive. Two, we do not know whether insurance companies are going to cover off-label prescriptions. It will be indicated for Dravet syndrome and Lennox-Gastaut syndrome.
Yeah.
That doesn't remotely cover the possible diagnoses that could benefit from treatment with CBD. My suspicion is that it won't be covered by insurance companies off-label, and it's even possible that the government would put some restrictions on its use, even though I don't think that's scientifically warranted at
Yeah.
all.
Yeah.
So that's a problem. As to profit, that's a whole proverbial can of worms. Obviously, the company hopes and expects they're going to make money from this. There are a whole bunch of other companies with these hemp-derived CBD products that'll want to continue to engage in commerce with them. We don't know what the government's going to do.
Yeah.
It could be that once there is a prescription form of CBD available, that the FDA will be more interested in intervening with some of these other companies. I don't know what will happen,
Right.
but I guarantee it'll be a mess.
Yeah. Regulation is the main hurdle, not that there is not a profit. Great. Thank you, Dr. Russo. That was for providing us with a fantastic overview and a lot of insights into CBD. In the next video, I want to ask you about medical cannabis and its use.